8 inches from my hand, I'm ending the life of the most innocent of our human family.
Dr. Bruchalski, I have been looking forward to talking with you, getting to interview you for, I think, years now.
It's so good to be with you.
And you have almost 40 years, I think, of medicine under your belt. You're a doctor, OBGYN, the founder of Divine Mercy Care, an organization that trains medical professionals to be pro-life, and then also Tepeyac, OBGYN, to serve women and provide real health care. So all that's incredible, and we're going to talk about that. But what I think is so incredible about your story is you are on the other side. You are not always pro-life, and you've done this yeoman's work in the pro-life movement now. So I want to talk about all of this, but starting from the beginning, tell me, when you were growing up, before you went to medical school, what was your family like?
I grew up in northern New Jersey in a great Polish, hardworking family. We prayed every morning. We said the rosary every morning. We were really well-formed. We prayed for the fall of the Berlin Wall, and in our lifetime, look what happened. And I still remember shooting baskets, practicing my foul shots the morning, I guess it was the afternoon of Roe. My dad drives up with his Volkswagen and yells, "Johnny, it's Black Monday. Our country has legalized the killing of children in the wombs of their mother."
How old were you?
12.
So you're in this super pro-life family.
Absolutely. We went to the march a few years for, my dad taught at the prep school that I went to, and we were soaked in it. However, my mom and dad, being busy, entrusted our formation to the educational system. And like so many of us in the 60s, 70s, 80s, 90s, 2000s, and on, we were introduced to, God's a big God. There are many paths. Don't worry about it. God's a really loving guy. Don't worry about it. There's probably no sin. Don't worry about it.
So you're growing up in the era of Roe.
Yes.
And your parents are Catholic. You're going to a Catholic school.
Yes.
But my mother was raised Catholic, but never really understood like you. She would later come back to her faith. So I understand that, and she was, Boston Catholic. It's that experience of the parochial school world, but you're not really getting the formation.
Correct.
There's this there are these profound disconnects happening.
There's a disconnect happening in the educational system. There's also a disconnect happening where you become not a God pleaser, but you become a man or woman pleaser. Mm-hmm. And I've got to be honest, I lived a lukewarm life because truth and love became lukewarm.
So what made you choose to go to medical school? When did that light bulb first go off for you as a kid that I want to be a doctor?
I had an older cousin, and he wanted to become a doctor. And he was the one that told me, "Oh, John, there's an overpopulation problem." Because he had gone to a huge secular college. And oh, by the way, there's an overpopulation problem, and we need to liberate, make women equal. That was really what got me into OBGYN, was trying to really help women live healthy lives.
So that was the passion.
That was the passion.
Okay.
Now, overpopulation was in the background, of course.
Sure. It's
as
the
well
verbiage
as
of the post-Roe world of,
right.
We need abortion and birth control and all these
right.
things because they're going to liberate women. I mean, that's the
Correct.
sexual revolution message.
Absolutely.
Which was prevailing at your time. And it was prevailing even in Catholic, unfortunately, some of Catholic education.
Yes.
There was a lot of confusion post-Vatican II. And with the event of the technology of birth control, the birth control
yes.
pill, what do we do with this? And the church was very clear. No, birth control separates unity of the couple with the potential for procreative, so it's bad.
It separates love and life. It
yeah.
separates something that was put together from the beginning of the beginning.
Right. But a lot of everyday Catholics, I think, missed it because what they were hearing from the culture was birth control is amazing,
yes.
and Roe v. Wade's this good thing for women.
Correct. And now we know it's a class 1 carcinogen. Mm-hmm. We actually believe that I don't believe it's good medicine.
Yeah, it's not. So you're in medical school now. And you're choosing to specialize as an OBGYN.
Right.
Talk to me about your first abortion.
So remember, abortion it comes out of the shadows. It's never, ever up front, except in only a few places, and that's just recently. So the chair of the department in medical school was very pro-life. She didn't want any abortions done, but because of the private practices of the professors, if you were open, they would let you watch or participate.
And what medical school?
This was at South Alabama, University of South Alabama's College of Medicine, I guess 1983 to 87. So I'm in medical school, and a wonderful doc basically understood that I had a knack. They saw me in the clinic. I was a real good student. I studied, but I was really good with patients. And I would listen. So we get to a case that's not marked on the board, meaning like there's nothing next to it that says I'm doing an abortion. Because back then it was the Voluntary Interruption of Pregnancy, VIP. It was many euphemisms.
But this is post-Roe.
This is post-Roe.
Why did they, just pause for a moment on that. That's so interesting. So voluntary interruption of pregnancy.
VIP.
And this is how they would catalog or categorize.
In the operating room, on the board.
And is that because abortion at that time, that name had enough stigma? What was the reason for that?
Abortion has always had a stigma. Because of the violence and because of the reality of, remember back then it was surgical abortions. So 8 inches from my hand, I'm ending the life of the most innocent of our human family. When they're little, they don't fight much because they don't even have real bones yet. But when they get big enough and the calcium has to get inside those bones, you have to count body parts. This was one of those abortions.
So this is your first abortion?
Yes, and once again, the man who taught me this asked me multiple times, "Are you sure? You grew up Catholic. Are you sure? Are you sure?" Now, I've done abortions, but that's me. Are you sure? Well, Doc, you told me that if I wanted to be the best I could be, I should do this. Now remember, I'm past my parents now. I want to set out on my own. So I gowned up. He says, "Yeah, gown up with me." You mean I'm not observing? No. I want you to know what it feels like. He's asking me that. Because remember, if abortion is so good, Lila, if abortion is such good, essential health care, why don't more of us do it?
I have seen, it's very interesting that there's such a tremendous push to make abortion popular among not everyday people, but among medical students, because most don't go into medicine saying, "I want to do abortion."
Correct.
They want to save lives.
Correct. It's in their
heal people.
It's in their DNA. The profession is healing.
Not to end lives.
No. And what happens is now if you read the literature, nurse practitioners can do them. No, PAs can do them, physician's assistants. Even a well-trained doula can do it. And in Vietnam, even an assistant can do it. Well, really? Why is that? There's 60,000 OBGYNs in this country. Why do less than 15, 10% do it? Because it's brutal. That's the reason. Because I tried. I wanted to be loving and compassionate. Forget empathy. Empathy is like, "Oh yeah, I really am sorry that you're suffering. I can't do much about it." Compassion is suffering with them. But then now, as we talk about medicine's an act of mercy, you go the extra mile for the goodness, the health, the truth of the patient and yourself. So here I am in residency. I'm now gowned up. "No, John, come here come on, get close."
How are you feeling?
Sadly, I was excited. I was excited because I knew this was a part of the profession, and I just wanted to provide good OBGYN care. So We dilate the cervix. You know, she's under anesthesia, so this is a private patient, so she gets the full gamut. She gets put to sleep. There's none of the crying or the wailing or the sadness that occurs. And he loves this. I mean, he cares for this patient. Remember, this man, he really wanted their best.
How far along was she?
10, 12 weeks.
So a late first trimester abortion.
Correct. Bones, limbs.
Bones, limbs. Talk to us about, just for folks listening, what is a baby at 8 to 10 weeks? What's the development of that baby? Embryo, almost fetus-like.
It has a rapidly, wonderfully beating heart. It's about the size of a little bit, maybe the first digit of my thumb. It has arms and fingerprints. It has eyes. It has a belly button. It has, well, not a button, but it has the umbilical cord. It has a liver. It has a stomach. It listens. It knows. It's beginning to know the sounds of the mother's heartbeat. You know what's amazing, Lila, is that for the last 50 years of Roe, we now have better medicine and better science. It's exploding what we can do surgically to the fetus, how the 4D ultrasounds bring out the reality. When I heard recently that, they don't really have a heart until 18 to 20 weeks. Once again, they're just manipulating. Well, they're manipulating words and lying, just like they did back in the 70s. When does life begin? Oh, it doesn't begin until the mother says so or until it's implanted. All of a sudden, it came out of nowhere. The same thing's happening now. There's no heart. Oh, it's just a tube. Oh, no, it's a tube with it's pushing blood. But I just wanted to say to you that little one ended up in my suction canister and on the table in pieces. There were arms and bones. You could see that. There was calcium there. It wasn't just a glob of tissue.
What was that like when you saw that little child coming through?
I can tell you that there was something registering somewhere in my psyche. I can't tell you. Maybe it was my mom and dad's love. Maybe it was, once again, live action talks, you guys intercessory pray for people like me. It works. There was a twinge. But I had to steel myself before doing it because deep down inside I knew what I was doing. But I was excited to do it because it was a part of my specialty today and women wanted it, or I thought they did. It was good medicine. I was helping this woman overcome an obstacle to her happiness.
What was the professed obstacle at the time?
Having a child at the wrong time.
That was
with a man,
purely elective.
Correct. As best,
procedure.
This was an elective abortion. This is what is 99% of all abortions. It's the most elective. It's the one where it's just inconvenient.
So when you left the room that day, that fateful day, that first abortion, you saw the baby, you had the twinge in your heart, what thoughts were going through your mind when you left that office?
That, my professor patted me on the back. And I can say today that I was lukewarm. And I think I wanted to be the best OB, but I really wanted to be liked. And that was it. I just left that room with realizing that I took a life, but you don't go there in that moment. Just like the woman has 10 to 15 years to get to PTSD most of the time. Why do you think we do studies about asking women right after their abortion or a year later or 2 years later, hey, was the abortion good for you? Well, of course, the answer is going to be yes. That's a human defense mechanism. You just go out further. And I just believe that the summer of rage, this anger that we're seeing, is nothing more than post-traumatic stress disorder. Because you can't change the truth. You can't change the reality that you took the life of the least of your family members.
Well, and I think you're spot on that so much of the rage around abortion from the pro-abortion side is trauma. because there are so many that are post-abortive that haven't reckoned with it. They think it was some sort of boon for them, some empowerment act, and it really is crushing when you consider it in your psyche, deep down, what happened. A child was killed.
Yes, ma'am.
That could have lived and may still be alive today if he or she had not have been killed.
Correct.
And reckoning with that is devastating, but for the option of mercy, forgiveness. But to go there is a spiritual place that it's so hard for many to even enter into because there's fear and shame and anger. And
women choose abortion because it's the least worst option. As they tell me in my office over the last 30 years, or almost 30, Johnny, I have no option.
And
I have no choice.
And see, that too is such a devastating thing, because I was just interviewing a woman, or speaking with a woman who had an abortion in Los Angeles, and she was a younger woman, single, and she said, there was no help for me, and adoption would have been horrible because they would have gone into foster care. And I said, that's not how adoption works, first of all. You can make an adoption plan, which is part of a parenting plan, ultimately, a gift to this child that you're not killing, you're letting live. Open adoption, closed adoption, you can select the family, the terms. There's so much
everything
you can do.
Yes.
But she didn't have, the people that should have been telling her that, she went to Planned Parenthood, even in their name, they should have given her options. They could talk about choice. Where was her choice? There were no options on adoption.
Zero.
There was no support for carrying that baby to term. There was no financial resources, certainly for her, from Planned Parenthood. It was, here's 3 kinds of abortion we can do. Going back to this history, this timeline here, you just did your first abortion. You would go on to do several dozen more abortions in residency. Talk about that.
When I applied to residency, so here I am in medical school, and I applied to some of the best residencies on the East Coast. And Eastern Virginia was where I landed. It was a contraceptive research and development center, Conrad. And it was also the home of the first IVF child in the United States. Howard and Georgiana Jones, 2 just gods in the OBGYN world, got kicked out of Johns Hopkins at 65, and they ended up in Norfolk, where they started the Jones Institute for Reproductive Medicine, the home of many, many, many IVF children. In fact, they led the way in this country. Many doctors across the country, from Cornell to USC, they all trained there. They all did a residency. They all visited there back in the day. Now IVF is everywhere. So once again, this place respected people's religious belief. But if you couldn't do abortions, it wasn't advertised. And once again, it was another place where abortion was in the shadows. Now, this is already 1987. 88 and 89. So I did abortions the first 2 years of my residency. Most of those abortions were on the OB floor because we were doing abortions eugenically for illness, for extra digits.
Extra digits. So if the baby has one more finger.
So I'm going there thinking children are sexually transmitted diseases. I'm going there believing that you can just hormonally stop them or end their, morning after pill easily, and only do it when the woman wants it. Now let's get to the heart of that. The heart of bioethics in medicine today is patient autonomy. So beneficence, maleficence, and justice flow from that. So I'm a vending machine.
So whatever to break that down, I think that's such an important point ideologically here. It's whatever the patient wants. And so if and today it has a lot of consequences, that attitude. It's like if the patient wants to die, and there was just a teen girl in Canada with an eating disorder who was euthanized.
A dear friend.
If a patient wants to die, and if your teen daughter or the teen patient has an eating disorder and wants to die, you love her, you give her mental health care, you support her, you do not kill her. But this twisted medicine to kill, to end life, instead of medicine to heal and to save life.
Yes.
And that's, of course, what abortion is, medicine to kill.
Absolutely. It's saying that we need to kill your baby to make you healthy. We need to kill your baby to give you happiness. We need to kill your baby to bring health and wholeness to you and your family and your community. And now, because it was foreseen, we need abortion to end poverty, to end climate change.
To stop climate change.
Right.
When you're a resident and you're going on to do these dozens of abortions, and I appreciate you willing to talk about this, I can only imagine how hard it is. From now you're on the other side, seeing what this really is, what abortion really is. Can you share more about that?
Sure, my friend.
And you were talking about eugenic abortions. You said we're on the floor, the OBGYN floor, and these are considered, abortions for cause. You could say, medically indicated. The baby has an extra finger.
Or
the
a
baby...
perinatal adverse diagnosis. Or something where the child is going to die soon after the umbilical cord is cut. Because once you end the mom and baby connection, that child has to stand on its own. The address changes from inside to outside. The mom can no longer give it nourishment and food. And so we did abortions for just about any, kind of holes in the spine, small, medium, or large. There was no distinction. And so if there was a defect, the answer was abortion is an option to prevent you and the baby from suffering.
And that was the prevailing ideology of the early 20th century to today. There's not a break in the line of ideology, in prevailing ideology, which is that if you are sick, if your life is not a good quality of life, this quality of life language is very much part of it, then it is better to die or to be killed. In the case of the child, they have no choice to die. They're being killed, right? And that is based on the eugenic ideology of, Planned Parenthood's founder, Margaret Sanger. She didn't want certain populations, including the disabled, to populate. And so she used birth control to control them.
Right.
And we're basically we're practicing our own self-eugenics.
Oh, absolutely.
It's not being put on us the way that it may have been 100 years ago, in the sense that it's not being forced in the United States directly. But the attitude of the medical profession, if you have a sick baby, is you should abort. I mean, even when I was pregnant with my first son, and I went to my first OBGYN, I didn't know her politics or anything, and I'm not even 10 weeks old, and she's telling me about genetic testing that the state of California practically mandates. I mean, it strongly encourages.
Mandates.
And I kept saying, why? In case there's an indication, and there's well, what would I do with that information? Well, termination.
Yes.
If you have a health defect, your baby has any kind of a condition, termination is the solution, as opposed to care and support.
Correct.
And
the pressure put on moms.
The pressure put on moms.
The pressure put on moms, because once again, it's another wedge to get between mother with child and convert her into a woman with a right to abortion for the good of herself, the good of her child, and the good of society.
And even the language changes.
Of course it does.
I know you've seen Dr. Bruchalski, because when I'm there as a patient, it's like your baby, your child.
It's wanted.
And then all of a sudden, if the baby is sick, it's a termination of the pregnancy. There's no, we abort the baby, of course, they're not going to use that specific language. And the language is so, when you're sitting there as a woman, if you're not really educated on this, and depending on what's going on in your life, and you're professional that's supposed to be, shepherding your pregnancy and your health care, is telling you need this abortion or you should have this abortion.
Right.
It's a powerful position that they're in.
Yes.
And the pressure that you're experiencing as a mother.
And today we are going after vaping and cigarettes. That's behavioral. And we've decided as a culture that that's something that we should probably stop. And yet when it comes to children in the womb, remember, children are sexually transmitted diseases. They're a pain, you have one or two, and then you kind of get on with your life.
And you tie your tubes and move on.
Well, right.
It's
And I'm from Virginia.
Wisdom. Yeah.
And I'm from Virginia, where the Supreme Court case, Buck versus, the sterilization of the feeble-minded. It's where the Eastern European Nazis came back in the 20s and 30s.
Forced sterilization is the legacy of Planned Parenthood and Margaret Sanger. She actually proposed not just forced sterilization. So she had a whole policy that she recommended, which was a one-child parent permit policy. So China's one-child policy, as we understand it, and what they've done to just the mass forced abortions, mass forced sterilizations, that originated with Sanger, Planned Parenthood's founder in the United States, who actually wrote the first public policy recommendation for that the government should give parents permits, and you could only have a child if it was permitted.
Correct.
And you should only get to have one child.
Right.
And certainly the disabled and other unwanted populations, if you're less abled, you shouldn't be allowed to procreate.
And now what's flowing down is if you don't buy the abortion line, you might not get the permit to practice
Right.
through your license.
And that's the other insidious side
So
of it.
now it's coming and it's here already.
It is here. And speak to that too, if you would. I know it's a sidestep, but an important one. The pressure put on doctors today to
Right.
it's not even about religious, they say religious freedom, doctors should have religious freedom not to commit abortions.
Right.
This isn't even about religious freedom.
Right.
This is just about basic right and wrong,
Right.
and a doctor not being coerced or a nurse to participate in homicide.
Right. However, the way the language is written is that, and I just got back from being in the Midwest at a big city and listening to medical students. What about access to an essential health service? Remember, the word essential reproductive health service is what is the language. And it's not considered homicide, it's considered compassion. It's considered top flight care. And yet it's a paper tiger because doctors sure as hell don't want to do it because of the brutality. Nurse practitioners and physician's assistants, once they see this for what it is, oh, since they're not going to do it, we want you to do it. Are you kidding me? So access is a big problem right now. And oh, by the way, it's an essential health service now. And then the bioethics of the American College of OBGYN say, you know what? Your conscience is really nothing more than a private feel-good, with all due respect. I think that you should refer or perform them in order to provide access. Meaning, we're not supposed to bring into our exam room or the operating room anything from our conscience.
And what is medicine without conscience? It's complete.
Oh, mercy leads to the gas
disaster.
chamber. It's a disaster, and we've seen it.
And not a disaster in the sense of a natural disaster, but it is the powerful against the weak.
It always comes down to might makes right. Always. When you unmoor the truths, the justice from a constitution, from definition, from language. And I think that that's where today with Dobbs, once again, not just to get back to what you were talking with, we have an opportunity to say the word abortion, to say it, to actually say it and to examine ourselves. You know, I sit here with you, Lila, and I'm trying to pull the plank out of my own eye, meaning the way that live action has helped, for me anyway, is just look at myself, look at the consistency in my beliefs. And you've done it from the beginning when you started, but I think for many of us, it's an examination of our own conscience, of our own beliefs, in a way that matters. Not just like a rubber stamp, but is what they're saying real? And then listen to the other side, and is what they're saying real? Wrong answer. We'll see it. You can't hide behind, oh, it's not really a heart until 20 weeks. You tell that to a mom
Right.
who went for her ultrasound.
It doesn't make sense.
It makes no sense, even experientially.
The Guardian recently did an article, you may have seen this, 10 weeks, this is what a pregnancy matter looks like after a 10-week abortion. And, you know, there are these images of just like white
froth.
White froth, material, and there's no embryo, there's no baby, there's no human life there because they just removed them from the image. But they pretended like this is actually the aftermath of an abortion. And they're doing this, of course, to desensitize people, to try to trick people into believing that abortion doesn't really kill anyone. There's no human life involved. It's just this medical procedure, the termination of a pregnancy. But it was interesting to see on social media a post where a very big Instagram account, millions of followers, put up this article proudly saying, look, guys, this is a pro-abortion account, feminist account supposedly, saying, look, guys, it's not really anything at 10 weeks, no big deal, abortion, it's good for you, look at these pictures. And thousands of comments from pro-choice women saying, guys, this isn't it. I had a miscarriage. I could see my baby. Guys, I'm pro-choice as they come, but this is misinformation. This is disinformation because you took the baby out, you took the fetus or the embryo, you removed them from the image. Their own people weren't buying it. And that's the power of social media, is it's a democratization of information. So people are like, hey guys, you might have a big account and be part of the Guardian's, pro-abortion lying network, but we know this is false. They're not buying it anymore.
I have to tell you
Abortion's violent, and
Yes.
there's an embryo there with the death of a child in an abortion, and you can see, and like you saw with the 10-week abortion, that first abortion that you did, you saw the baby, the pieces of that baby.
And absolutely, it goes along with my experience. When a woman sees the plus sign on her pee stick that she's pregnant, her eyes, her heart, whether it's wanted or welcomed or not wanted, there's a reaction to the plus sign. Number two is just think of the moms who miscarried their baby. Whether it was many times early on, your nausea has gotten to you and you're just tired and it's just a pain. But when that miscarriage occurs, the tears, the sadness, the reality is there. And if this is the best they can do, oh, there's no heart. Oh, there's no baby. Once again, my heart, with all due respect here, it is a lie, but I lived that lie.
How pro-lifers understand the psychology there, because you just said you lived that lie. I mean, that's a very powerful thing to admit. And you're in residency. You're doing. I think you've done dozens of these abortions. You're pro-choice, obviously, and you're, as you just said, living the lie. Walk us through that psychology.
Well, it's a challenge. Each time that you do a termination, you have to steel yourself. You have to take a deep breath in, and you have to have a gut check, because the reality is we know it's a human life. And so what happens is that you're doing it for the greater good. You're doing it for the woman because she wants it. And you're growing up in a world where patient autonomy, I'm a vending machine, and I want to be the best vending machine I can be. No, wait, I don't want to be a vending machine. And that's where the fracture occurs. That's where, why aren't there more abortionists? Why aren't there more long-term abortionists?
But you didn't last very long.
I lasted,
doing abortions.
No. In fact,
Your fracture,
my
it was part
fracture
of your
occurred-
childhood, I'm sure, but tell us about your fracture.
so I'm driving to the beach down in Virginia Beach one afternoon on a weekend.
And you're a resident.
I'm a second-year resident,
Okay.
and I'm busy. I'm on call every third night. It's one of the best medical schools on the East Coast. We're doing everything. We're a part of something bigger than us. And I'm driving by and I see a crisis pregnancy center. So I pull in. I'm like, what's this? I go in and they're getting ready for their evening session. They're providing alternatives to abortion. I keep my mouth shut. I look around. They invite me to their church, First Assembly, big evangelical church, loved it over time. But I was just, what? I mean, I wasn't even a believer at the time, but I liked what they did. They were very honest. They provided real solutions, real alternatives.
Did they know you were practicing abortion at that
Well,
time?
they knew I was a resident, but they didn't know. Of course, I'd keep it quiet.
With this conscience in you,
It's that still small
there's
voice.
something attracting you there because you're working out this thing, you're doing abortions, and you're just not, deep down. I mean, you're raised Catholic.
So I'm going to tell you,
got
I
these
was
Catholic
raised
parents.
Catholic. My mom and dad prayed for me. And they continued to pray for me. They continued to pray the rosary for me. They continued to be in scripture for me, sending me little notes, different verses.
Did they know?
All,
Did they know you were doing abortions? They did. You told them.
of course.
What did they say?
They were aghast, and they couldn't say anything. I grew up in an old Polish family. We didn't talk. We talked when they were younger, but they just looked at me with eyes. They both teared up.
How did you have the, I guess in a way, courage to admit that to them? Or were you being rebellious in that moment? What was it that you even brought it up?
I was somewhat rebellious, but I was somewhat trying to help them see the reality of my life and the reality of the way the world has changed.
You thought
I
you were
wanted-
helping them.
Of course, yes, because my nature is to assist, codependence, to assist, to care for the other. But now I was doing it from my experience of terminating during the residency. And it was a tough conversation to have because I didn't can you imagine, I was so self-absorbed that I didn't realize how bad they would take it. But they never stopped praying, and they loved me through it. And I think so many of your people that listen to you, they're integrated folks, men and women. Not only are they educated, but they're encouraged to really lift up the weakest, because, as you say, human rights begins in the womb. So the weakest and the littlest, Matthew 25 and all that stuff, it's real. And so anyway, I told them that. But my psychology of it was, I'm doing it for the greater good. I'm just doing it because it's needed today. Because women, unwanted pregnancy is a real problem. When you read every study, that's the first or second sentence, right? 52% of all pregnancies, right. 82% of all pregnancies are.
And I've noticed, I've been privileged to interview a lot of former abortionists, abortion clinic workers, women with their varied stories on this. And I've noticed there's different boxes, if you dare to put people in a box, but there's different, you could say, categories of experience. And I think the experience it's a common one that I thought I was doing good. I thought, and then the pricks of conscience happen, if you're involved with abortion, but I still think overall I'm doing good, so you silence that little voice. There is a group of people I've noticed that I think there's a bit of a, there's some greed in there. I talked with one, it was making me money. It was literally making me money, and it was a quick and cheap way to make money as a doctor. So there's different categories, but I think the overall one is I thought I was helping women, and I wanted to be part of this bigger thing of other people who told me this is how to do it.
Correct, absolutely.
The prevailing notion at the time.
I think you have your finger on the pulse. I do know that one of the places that I interviewed for a job said, John, you could triple your salary. And by that point, I was like, no, I'm good.
Triple your salary by specializing in this abortion thing that most doctors don't want to specialize in.
Correct.
Because you're making up to thousands of dollars, especially if they're later term per abortion.
Correct.
Yeah, and that abortion could just take a couple, it can take minutes to just a few hours.
Well, but even if it took a few hours or even a day or two, it's it's financially worth it.
Thousands of dollars, and you stack them.
Yes.
Yeah, and that's a real motivation.
Right.
I mean, you have these folks like Leroy Carhart, infamous late-term abortion, or Dr. Warren Hearn, if I dare call him a doctor, when he's one of the lead butchers in America, operating out of Colorado, and his specialty is late-term abortion. He's writing textbooks on it, and he is making bank. Or here in D.C., Cesare Santangelo, operating in the District of Columbia, killing babies almost up until birth into the late trimester, violating, by the way, we've documented this. The health code violations. He's just, forget caring for the mother, but he is, got his $1 million+ condo here, and he's making bank as the place to go for late-term abortion.
Yeah. Or Gosnell with his side narcotic business.
Yes. And Cesare Santangelo here in D.C. was the abortionist who was found on the sidewalk of his clinic, the condominium complex, medical condominium complex. There was a box intercepted, given to some pro-life activists, and they opened them up and found the bodies of over 100 children, 5 of whom were later term, intact, some of these babies, beautiful children who had been savagely, one of them looks like the victim of a DNX abortion at the hands of Santangelo. That means that little girl, they named her Harriet. She was probably 30 weeks old enough to survive outside the womb. He had appeared to have cut her neck, suctioned out her brain. This is illegal, violation of federal law, by the way. And he murdered this baby, stuffed him, in a medical box. For what? And the DC police were notified because there are illegal late-term abortions still. Thank God there's some laws. They turned the other way. Why? Because in the District of Columbia, the prevailing powers, Mayor Muriel Bowser and others, are pro-abortion. So they will not touch the investigation of abortionists with a 10-foot pole because it's not politically convenient for them, because they're going to get flack from their pro-abortion lobbyists.
The narrative is interesting because across the country, I'm sure more and more residents are being pressured to do the same. Now, once again, they're really making a push across the country to provide providers for it. Well, doctors are still pushing back and saying, no, we're not going to do that in our private practice. A lot of the studies have shown that. And I can tell you that it's still considered a very shadowy procedure that most of us do not want to do or be a part of. And I think that there's going to be a challenge here shortly with the chemical abortions about ending that pregnancy in the bed or the bathroom, the toilet bowl, the bedroom abortion.
There was just the case in New York. The woman is suing Planned Parenthood because they gave her an abortion pill, didn't do an ultrasound. This is what they do. They just give abortion pills. They want to mail the abortion pill telemedicine without any ultrasound to determine the age of the baby. And abortion pills are supposed to only be in the first trimester. I mean, the FDA, the Food and Drug Administration, fast-tracked this under Clinton. So it's all political. It's not about health care. This is a dangerous, lethal drug. And this woman is suing Planned Parenthood because she delivered a stillborn baby at 32 weeks after taking the abortion pill. I mean, horrific. And Planned Parenthood is just the one shipping her the pill.
Medicine, physicians, doctors, history and physicals, examining, laying hands on, is critical to excellent medicine. Seeing the body language, seeing the tics, the little twinges, the deep sighs, the angles of the eye when you're telling a lie. I'm telling you, this telemedicine abortion, Rh negative is the least of our problems. I believe we're going to see a long list of problems from this because we've gone telemedicine because of COVID, which they use that as a precursor.
That's how they fast-tracked it.
That's how they fast-tracked it. And on top of it, we're now doing this. So here I was working at a pregnancy center, beginning to go to this wonderful evangelical church, coming back to my residency and doing terminations or whatever else was needed. So here I am one night in one room. There's a young baby, about 22 weeks. Mom wants the baby. I'm doing everything I can to keep that preterm labor intact inside of her so we get it to viability, to get it out so the baby can breathe. In the very next room, separated by 8 inches of a wall maybe, the mom doesn't want it. Same gestational age.
20 weeks.
22, 23 weeks. But of course I didn't take a great history because it wasn't wanted. I didn't want it. So I broke water, gave her Pitocin, and delivered her.
Healthy baby.
Healthy baby, making noise.
What do you mean by that, making noise?
Oh, like crying, wheezing, making squeaking noises. Do you know what my first instinct was? To suffocate it and put a towel on it so mom wouldn't suffer. But because the baby was a little bit heavier than I thought, I picked it up and put it through it on a scale. It showed that it weighed 505 grams. So that's 5 grams over what the state of Virginia considers a human life. Under 5, so at 450 grams is a pound. So this was like a pound and a few ounces. I had to call the NICU, the Neonatal Intensive Care Unit, to come in and resuscitate this fetus, this born child, that I aborted, no matter what the mom wanted, no matter what I wanted. It was a state law, so I did it. In walks in the most wonderful, smart, articulate, integrated neonatal intensive care doctor. Those are the folks that take care of babies that are small, on the cusp, getting them to health and getting them home. She looked quickly and realized what I did, and she said, "Hey, Bruchalski, stop treating my patients like little tumors.
Wow.
Talk to me tomorrow."
What happened to that baby?
It went to the nursery and lived.
The baby lived.
As much as I know about it, Lila, it's alive. But I never followed up. I wouldn't have followed up. Why would I follow up? It was a mistake I made. I didn't do a good history.
And Dr. Bruchalski, your moment of conscience that prevented you from suffocating that baby, as many late-term abortionists do, saved the baby's life.
Yes, Lila, but your heart is what matters to your wife and to your God. my heart was ready because I was bigger than it.
And it was only this little law. That's the power of law. People say, what are these pro-life laws? These abortions, they don't really do anything. And I say, laws save lives. Laws are teachers, and laws are powers to save. And that law prevented that child from being killed. Ultimately, that law saved that child's life because it would have been left to die, as many children are in these abortions.
I know. I really enjoy that perspective, Lila. It's not something that I've appreciated enough. But yeah, I felt it. It was just, yeah, it was like a pound. And trying to be a great doctor, you practice feeling, super little ones, medium size, what's an intrauterine growth restrict. This is part of what good docs do.
But the insanity of our system is if that little one had been 5 fractions of a...
5 grams
5
shorter,
grams,
or maybe 6 grams.
6 grams less.
Yes.
Maybe, was it a boy or a girl?
I don't remember anymore.
Maybe girls are typically smaller than boys, whatever it would have been.
Oh, no, of course.
A few days prior, just a few grams less, you could have left her legally to die. Would that have been the practice of the hospital at the time?
Oh, it wasn't even
early delivery.
It wasn't even considered.
It wasn't even
correct.
considered.
No, because it didn't make the grade. What's the difference between that borderline between Colorado and the one that's pro-life? It's a state line that tells you the difference between a life and no life. Abortion on demand versus protection. So remember, Lila, at this moment in time, the data's coming slowly in about abortion and breast cancer, abortion and preterm labor, abortion and mental illness. So the data.
About the harm that abortion does to the woman.
No, remember.
Not just the baby, obviously killing the baby, but the harm to the woman.
Yes, and remember back then, abortion is good for you. There is no wrong. Come on, you get over it. This is one of the most common surgical procedures, and oh, by the way, it's almost foolproof. Number one is, the data was coming in by then. Number two is, whether it was for rape, incest, life of the mother, the pain and the suffering occurred before the abortion. The trauma was already there.
Right.
And I was compounding it. I kept waiting to see, oh, this is going to be so good. I'll see them in follow-up. Hey, how are you feeling? No eye contact. They would say, I'm fine. But as we all know, you do what you have to do, right? It was my only solution. So I understand not only the reasons why they do it, I also understand the reasons why they can't speak it. So there, for the grace of God go I, both medically as well as patient-wise. And so there they were in the exam room, and I wanted to hear, oh, this is wonderful. No. One woman basically said, hey, thanks for giving me a twofer. I said, twofer? Well, you killed twins.
This was a survivor of sexual abuse, or this was
an
abortion
No. This was a
patient?
patient who I aborted twins on.
And that's how she dealt with it.
That was her, yes, and it was so disjointed, just listening. And then we had data, we had the experience, the brutality. My heart was literally up in my throat because I was realizing that I was a vending machine. How come in 2 rooms I could save one and not the other? Isn't there science here? Isn't there truth? Isn't there justice? Who's the least? It's all part of the human family. The least, as we talk about now. And it really came home to roost. There were a few medical students asking me, why do you do them if, John, you're different when you do them? Really? These were young students, Church of Latter-day Saints.
Wow.
These were great people. And then the doctor challenged me at that coffee and said, hey man, you're better than this.
This was the doctor from
This
the
was
pregnancy
Dr.
center.
Debbie Plum. She and I have finally connected because of the book, and I've gotten a chance to say thank you to her. And I want to tell you, she said, Johnny, you take care of 2 patients. 2. Because they're genetically different. They're 2, we didn't have 23andMe back then, but now I know they are, because we do 23andMe. I'm telling you, so.
And that was the moment, lunch with her, after that lunch was that?
It was a witness. It was the
a
witness,
moment,
plus the data, plus my experience, my hardness of heart. And then
and
she
your
said,
parents' prayers.
And of
Your
course,
Polish parents'
my
prayers.
Polish parents' prayers. And that was consistent through the whole thing. And that's when she said, hey, listen, I just got back from a place in Yugoslavia. I found peace there. You should go. A few days later, my mother said the same place, believe it or not. I thought it couldn't have been a coincidence. And I like traveling, and I like Dubrovnik. And I like strong coffee, and I went to Medjugorje with my mother. And it was on a hill there that I lost, I saw myself as a leper, and scales came off my eyes in prayer. And once again, there for the grace of God go I. Once again, this is nothing that I earned, but I was born into a family that actually consecrated me to our Lord, consecrated me to the cloud of witnesses that the saints of the faith are real. They've lived lives that can make a difference in yours. And I'm convinced that when my mom was in the little room in the upstairs of this house, I'm sure she was saying the rosary for me and reading Romans. All things work to the good to those who love him, who are called according to his purpose.
So coming home from Medjugorje, you're a changed man.
Yes.
And you're with your mother, who's been praying your entire life for you, but especially, I would imagine, the last 10 years for you.
At least.
And what happened when you got back? Did you have an abortion scheduled? Or what did the change look like next?
So there was nothing really scheduled. And I flew back with my mom pretty much in silence, holding hands.
Did you tell her? You told her after that hilltop experience?
So I heard, practice excellent medicine, see the underserved daily, and follow the teachings of my son's church in scripture and tradition.
This was a message you felt from the Blessed Mother in the place where she appeared, Medjugorje.
Yes, it was internal. It was profound. I fell on the ground. I was a man of unclean lips. I was a man of unclean heart. I didn't deserve. And then you realize, no, he loves you. And he arranges life. He's a funny guy. He arranged life. He waited. He enabled me to break down. And so, and then, oh, by the way, go show yourself to the priest. And so can you imagine, bless me, Father, it's been 15 years since my life. I dismembered a child last week.
And
so
that was an actual thing you...
That was an actual phrase from that. But what I want to tell folks is Scripture is real. Sacraments are real. This is not like a joke. This is not... And the pro-life movement can really unify the body of Christ. Now, with all that said, I knew I had to confront my professors. So I went to go see Dr. Georgiana Jones the first moment I got back. And, excuse me, Dr. Jones, I just want you to realize that I went on vacation with my mother, and I realized that I can no longer suck eggs for in vitro or sterilize or do abortions, especially those sick babies. I've seen the light. There's a better way to do all of this. You can educate women about their body, just like you've taught us in your clinic. And oh, by the way, we can do perinatal hospital. I could see it. I was a different wineskin coming off that hill. It's this burning fire inside of you. I've seen it in you. I've seen it. There are the least members of our family being brutally taken out. And it's our generation, it's us. We're the ones that have to respond. And then over time, my friends began to ask me, and I began to tell them. And many of the residents during that time would not do adverse prenatal diagnosis abortions. And most of them were not doing the elective abortions anyway. They just needed someone to kind of take that step. And we had great conversations on labor and delivery now because of this. And several years later, after getting out into private practice, I knew I needed to follow those 3 principles. My wife said, it's now time. And so we started Tepeyac OBGYN out of our basement initially. My wife, Carolyn, I could not have done any of this without her. We got married right after I finished my residency. What a wonderful woman. And we, like I said, started in our basement. Then some doctors let us use their offices. And then by October, we were able to raise enough money for our own building. And we tried to see everybody partner with pregnancy resource centers regionally, both in DC, Maryland, and Virginia. But over time, the costs of healthcare, the accountants, we then went not-for-profit. And so now we're an almshouse.
So this is Tepeyac OBGYN,
yes.
your not-for-profit, one of your not-for-profits. Yes. And tell us what you do at Tepeyac OBGYN.
So,
and what are those 3 principles that you mentioned?
So at Tepeyac OBGYN, we are seeing women holistically, integratedly, and whole, as a whole. You can't separate body, soul, and spirit. You just can't do it. There is a higher power and you're not it. So you better be praying and meditating on the spiritual side. You better be eating well and exercising on the bodily side. But you also need to work with good medicine that either could be from the medical world or the bioidentical world or the homeopathic world. All of this is for our betterment. And so we treat, we do great deliveries. We see, we're like a mom and pop bread and butter OBGYN practice. We're excellent about cooperating with your fertility. We try not to suppress fertility as much as we can. We actually run a perinatal hospice now. It's real. People from Carhartt come to us that are saved there through the folks outside, 40 Days and others. We see them.
So these are women who are on their way
into
to late-term abortionist Leroy Carhartt, who was practicing in Maryland.
Yes.
And they get turned around by brave sidewalk counselors who are lovingly providing actual options for women. And these are the sidewalk counselors, by the way, that the Department of Justice is now going after under President Biden. Correct. To try to throw some of them in jail.
Correct.
And literally swatting their home. The FBI showing up at Mark Hawk's home in Philadelphia, who is, outside of Philadelphia, who is a sidewalk counselor saving lives, and they're terrorizing him and his 7 kids because he's on the sidewalk praying. That's what we've come to. But these sidewalk counselors are, helping intercept this abortion-minded women, encouraging them. They're choosing life, and then they're coming to you, and these are babies that are with a diagnosis. They're sick or there's a condition, and you're there to help treat mother and baby.
Right, by using high-dose progesterone. Maybe we can reverse some of the chemicals that we're given. Maybe we can walk with them through this. It's literally, health is relational. Health is relational. It's about sacrificially relational. It's how doctors used to be with their patients, going the extra mile, making the house call, caring for the whole person and helping them despite their obstacles to healthcare. It's more than compassion. It's much more, actually. And so health is relational. Medicine's an act of mercy. You hate the disease, but love the patient. Hate the disease. You don't get rid of diseases by getting rid of people with those diseases. And then thirdly, by collaboration and cooperation, we can create communities that abortion is unwantable and children are welcomed and fertility and family are respected. And I think it's integrated. I think it's good. I think we've worked with social services from the government. We've even gone to abortion clinics and said, hey, can you send your, the women that are just broken and you can't go through with it, send them to us. We'll figure it out. So then we went not-for-profit. So it's an almshouse. We go to our community and say, but in order to do that, we created something called Divine Mercy Care, which is our umbrella nonprofit that helps raise that money, the alms, for the practice, but also shows people across the country there might be another way to survive the crazy medical metrics that are crushing private practice right now.
Well, I think that's so important because along with empowering medical students to reject abortion entirely, because many of them are being forced to even commit or to observe abortions as part of their training to desensitize them. I mean, we get calls from medical students all the time saying, what do I do? They're telling me I have to go observe an abortion today. I'm like, no, you don't have to do any such thing. And you actually have legal rights to not do such a thing. And it shouldn't harm your career as a doctor. But beyond that, too, as you say, how do we help doctors provide holistic care? OBGYNs have practices. Share more about that.
So it's exactly what you just said. When they call you or they call us, all we do is come alongside them one-on-one, listen, figure out what they need. Because, we've been through the residency. We've helped through our program of people working in the office. They've gone on, whether it's been a medical assistant or a nurse or a young student, a young college student. Well, they've all gone on to healthcare jobs. And so what we have found is we just come alongside the person who calls you. And I don't want to say it's an underground railroad, but it's an underground railroad where you can connect them to the American Association of Pro-Life OBGYNs. You can connect them to the Catholic Medical. You can connect them to the Christian Medical and Dental. You can connect them to pregnancy resource centers, her plan from the Susan B. Anthony list. What we show them is it's much more courageous to not kill the least. It's easy to kill the weakest. They have nowhere to go. And so now, if you really believe out there medically that you were called into medicine, nursing student, nurse practitioner, PA, the whole gamut, midwifery, where did that call come from? You got to be obedient. No matter what your mom says, no matter how much they fear-monger you, no matter how much they say, oh, no, there's a group of us out here that really, we're looking to the future. And I can tell you, it's really looking brighter because there are more and more folks, despite what they're being told, that enter the profession.
Well, and that's the power of Divine Mercy Care. What your organization is doing is providing an example of what holistic pro-life health care, OBGYN care looks like.
For women. It's not women. Religious.
Right.
It's excellent medicine, period.
And I think we need more. I think it's so hard out there with, reproductive technologies that are not just reproductive technologies, but are actively harming life, that are ethically problematic. Of course, abortion and the crisis of all the children being killed with abortions. We need more aspiring doctors, to see a vision of what pro-life medicine looks like.
Right.
That's authentic medicine.
Right. And for 50 years, Lila, we've lived under Roe, which means we have 50 years. So a doctor who's now 75 is the only one who hasn't practiced in a world like this. And that's going to take some work. Yes.
What does the future look like? We're post-Roe v. Wade now.
Right.
You have Tepeyac, OBGYN, and Divine Mercy Care. Right. I mean, you've been at this almost 40 years. Has it been 40 years?
Yeah.
And it's incredible what you're doing and the example that you set. What do we do, though, moving forward? Because, ACOG, in the American College of Obstetricians, Gynecologists, very pro-abortion.
Correct.
They don't want to hear a single voice of dissent. What do we do in this new climate?
So several things. One is that abortion has always been, from its beginning, political. It shows up in our textbook in 1973, given from the top down. We never voted on it.
So ACOG, and this is important history, ACOG was, the association of thousands and thousands, 50,000, 60,000 doctors, OBGs, GYNs, and they didn't, it's not like the poll was taken in 73 to say abortion is now a good thing.
Never.
They forced that on the population of OBGYNs, and now if you're a doctor and you want to be part of that association, being pro-abortion is part of what they say you need to be.
The rite of passage or the fact that you're a good doctor. It's like a rubber stamp. It's like a political,
sick.
it's actually a political litmus test.
But there is the American Association of Pro-Life Obstetricians and Gynecologists, but that's only a few thousand, maybe 3,000 members. But of the 60,000 at ACOG, I know many of them don't do abortions, many of them are pro-life, but you want to keep that credibility. They've created this credibility system, and that's what's so patently political, as you say. It's not about healthcare, it's about pro-abortion politics.
And that's why now, because of Dobbs, we can say the word abortion, which means we can speak about it. And so when they say, oh, it's miscarriage care, no, it isn't.
Right, because in a miscarriage, the baby has already passed naturally.
Correct.
And it's a tragedy. And delivering that baby who has passed is not an abortion.
Correct.
It's the delivery of a baby who has passed. And an elective abortion is intentionally killing that baby before birth.
Yes, elective abortion is always the direct killing. It's basically saying, oh, in order for you to live, that your child has to die.
But they have to blur those lines.
They have to, because the mother, you've got to get it past the mom, and you've got to get it past the doctor.
And they want to make it acceptable.
Absolutely.
Culturally.
And once again, let's just say that there's a horrific situation of hemorrhage or infection. We as doctors, remember what I told you before? Hate the disease, but love the patient. You always treat the disease. And sometimes, early on, a baby with a heartbeat might be trapped in that treatment. We never intend the direct. But since logic and words no longer mean much any days, right?
But this is such an important point you're making, which is you're making the point ultimately that abortion, the direct intentional ending of a life of a child, is never medically necessary. That you may have to target the disease, as you say. Maybe there's there's an infection. You might have to do an early delivery of the placentas, and that might mean an early delivery of the child, and there's no way around it. Right. But you're trying to care for that child and trying to give that child a chance.
Because from a physical and a mental and a spiritual point of view, you never pit mom against her baby, ever. Because she's the one that's got to live with herself and her actions. And her doctor, oh no, he recommended it. I needed to do it. I understand. Because once again, I can't throw stones. My heart breaks when I hear that suffering. Because there are so many ways now, also for 50 years after Roe, we have better science, better medicine, better technology. So what we do is that if you have a life-threatening diagnosis, most folks now will basically say, well, you have a disease that can cause all these problems. Let's just end it now. It's easier, quicker, safer to do. Well, nothing has happened. The woman is still healthy. But remember, back in the 1950s, diabetes used to kill women. But through technology and good care, oh no, diabetes, hypertension, we've done so many good things. And since the timing of the child's ability to live outside the mom is coming lower and lower. Back it was 26, 27 weeks when I was in residency. It's now 22, 23 weeks. All of a sudden, you have great care. Well, you can care for mom and her unborn, whether it's in an ICU setting or a monitoring setting.
So are you hopeful for the future? You sound very hopeful right now. Technology can be in our favor to help mom and baby. We can educate the next generation of medical professionals. What do you see in the next 10 years? Post-Dobbs, Roe is no more.
I think we have truth on our side. That's the most important thing. And we have science. Now, we're going to need to have language, and we're going to have to learn from each other what language resonates, what doesn't. Because I can tell you, going to a medical school, hey, if abortion is so good, why don't more of us do it? That resonates. Because they assume, or the young women at GW who I challenged and said, you think abortion's a loving option? Go do it. 2 years later, they came back and said, we can't do it. Why is that? It's brutal. So I do believe that the truth of the ultrasound, the truth of medicine, the truth of fetal surgery will eventually catch on.
And what about the abortion pill?
How well?
Because that's an escape route. I bet for doctors, I'm not even going to do the abortion. I'm going to send you a pill. Or it's not even doctors sending the pills anymore. They want to make the pill available. You buy it at the drugstore.
Over the counter, right.
And you just buy this pill, you take it, and it's forcing this brutal, basically a miscarriage. It's forced, and those could be horrible, but there's no medical oversight.
So you're spot on again. I am hopeful because of the way the story ends. In the near future, there's going to be so much pressure put on us by the Congresses that believe in abortion on demand at any time for any reason.
So you think they'll overplay their hand?
They're going to overplay their hand, and I think in that overplay, it's going to become obviously grotesque.
And that's like the New York story, because they're already overplaying their hand. Abortion pill through telemed, the dorm abortions. We want abortion pill available on college campuses in California. I mean, it's insane. And these are pills that land a certain percentage of women in the emergency room because it doesn't actually end the pregnancy, and it's an ectopic pregnancy, and now they're in a life-threatening situation. There's no medical oversight.
Correct.
So they show up in an emergency room.
Correct. And the ectopic pregnancy is just 1%. Can you imagine flushing out of your body violently and painfully and with lots of blood your child, where you're going to see the products of conception on your bed, on the floor, or in your toilet? It's going to leave an indelible mark in the psyche and the hearts of mothers all over. And I'm convinced of that because we're using it like it's like the Wild West.
And this is why, early on when I would investigate Planned Parenthood, I would actually go undercover myself. It was always interesting. They offered the abortion pill, medication abortion they called it, but they would recommend surgical first trimester suction abortion because they said it's quicker, it's cleaner, meaning you're not going to see anything, they would say, and you don't have to go back for a second procedure.
And now you don't hear it.
And now they don't say that anymore because they want abortion to be back alley again, back alley in the bedroom. So behind it, no doctors involved. It's better for their bottom line. Think about it.
Correct.
They don't have to pay for brick and mortar.
Correct.
They just pay for the sending the pills and the whatever the cost of the authorization that they signed for that. But you're right, it's going to backfire. And it already is backfiring, I think.
Oh, it is, because I think women are going to say, this is barbaric and you didn't tell me about this. And then that groundswell starts. Yes. I'm so sad that the pain of our patients, the pain of, my sisters in the human family have to go through this.
And for what? The abortion lobby and the sickening politicization.
The politics and polarization of abortion,
yes.
Period.
Now, you just wrote a book, Dr. Bruchalski, which is fantastic. It's your story.
Yes.
We've talked about some of it, but it's also, I think in many ways, a path forward. Because what you're not just what's so fascinating about your story and you is you're not just a convert. Like, I'm not going to do abortions anymore. I'm going to just be a pro-life doctor. You're, I would say, revolutionizing not just the practice, but language, because language is part of the battle around women's health care.
It is.
What's the future of Divine Mercy Care and Tepeyac OBGYN?
Oh, there are many centers across the country in many states now who also see that women deserve better medicine, period. And some of those centers have kind of spun it out to more of the natural, like Guiding Star in the Midwest and across the country with midwives and integrated, holistic, natural care. There's a great medical practice in Phoenix, Morning Star OBGYN, where you collaborate and cooperate with the whole person. And then you have incredibly Bella in Denver.
Also amazing.
That just rocks. And that's just the tip of the iceberg. More and more students want to be doing this. And I believe that when you have a group like FACS with Marguerite Duane talking about fertility awareness and the science behind it, this is a multifaceted diamond in the rough. But it's the way medicine was Hippocratically, not hypocritically. I really believe that there's a way to show, to live it. It's what you do at Live Action. It's going on programs and talking one-on-one and talking to groups and talking to others and being a point of light in the midst of this challenging darkness where, yes, it's going to get harder before it gets better. We have, like you said, I'm so grateful for Dobbs, so grateful. But the work is just tripled because it's now in every state. And the lies that keep coming up It's like playing whack-a-mole.
Right.
But the reality is, if you live it like we do at Tepeyac OBGYN, we've been in business for 28 years. We've talked to some wonderful high-risk OBGYNs across the country. Elective abortion, the death of a child, is never needed to save the life of the mother.
And what's so powerful too about your ministry and you is it's a message to not just, pro-lifers or people that want pro-life care or holistic real care. It's that no matter where you've been or what you've done, so many of the women that are some of our best spokespeople in our movement and men, they've had abortions in the past. Yes. And they know the pain, they know the evil of it, and they've rejected it. They've gotten forgiveness. They've moved on. I mean, we all need forgiveness. None of us are perfect. All of us have failed in one way or another. And that message of we can change as a society.
The mercy of God. Yes, absolutely, Lila. You spot on.
So what's your last thing you would say to, if someone's listening, especially if they are an aspiring, I would say medical student. I do really think they need more support and attention. We need a new generation of doctors and medical professionals, nurses, doulas, midwives, everything. What's your message to them right now?
So my message to them is that if they've been called into medicine, they need to be obedient to it. Now, there are wonderful people out there, and we at divinemercycare.org reach out to us. We will listen, figure out where you're at, what you need. You tell us what you think you need because you know your life best. And we'll hook you up with various and sundry groups because there's so many more of us out there. That's the thing. They've been keeping it like a secret. Abortion's a secret. And the fact that probably the majority of their people think abortion on demand for any reason at any time is horrific. And there's a lot of good people out there who have gone before you, just like I stand on the shoulders of the folks before me. Well, we pass it on to the next generation, and I see this everywhere I go, and I'm grateful for that.
Thank you, Dr. Bruchalski, for your witness, your work. Everybody, read this amazing book, and thank you. We are cheering you on and excited for the future of America, which is a pro-life one,
Amen
and of our globe.
Yes, ma'am.
Thank you so much.
Thank you so much.